reason to have that, except that some of these nerve fibers, instead of going to the eyeball this way, choose to go to the eyeball this way. Right? They just pass through the ciliary ganglion. Have nothing to do with it. The ganglion is sort of in their way. So they go from the nasociliary through the sensory root, through the ganglion, out the short ciliaries to get to the eyeball. Just pass it through. No functional relationship to the ganglion. And then finally we have sympathetics. So remember, by the time we're up in the head, the sympathetics that we have are all postganglionic sympathetics. They are cell bodies of the superior cervical ganglion. They were synapsed upon by preganglionics that came from the T1 or T2 segments of the spinal cord, right? Ascended through the sympathetic chain. So they synapse in the superior cervical ganglion. The postganglionics then run along with the carotid system to get up into the head, and then some of those fibers leave the carotid by way of that sympathetic root, travel into the orbit, pass right through the ganglion. So they're on their way to the eyeball. The ganglion's in the way, so they just pass right through it. And when they get to the eyeball, their job is to innervate the dilator pupil muscle, the iris, dilator pupil, as well as vascular smooth muscle in the eyeball. Okay. So those are the various cell types that we have passing through the region, and you should be familiar with where they go, and pay particular attention to what is simply passing through the ganglion.